Welcome back to another session of Cancer Care at American Oncology Institute. I am Kisan Dhoni and today we have with us Dr. Rohit Kakde, consultant nuclear medicine at American Oncology Nagpur. So Dr. Rohit, we heard about the MRI, CT scan. So that one of the term PSMA PET CT. So we would like to know what exactly is PSMA PET.
So PSMA PET CT. PSMA stands for prostate specific membrane antigen, which is expressed by the prostate cancer cells on their cell wall. And there are receptors of prostate specific membrane antigen. So what we have done, we have made an antibody or a small peptide against this prostate specific membrane antigen, and we have tagged this with a radionuclide that is gallium-68 or F18. So when we inject this F18 or gallium-68 PSMA radiopharmaceutical, it is taken up by the prostate specific membrane antigen expressing prostate cancer cells. And the radionuclide, that is F18 or gallium, it emits positron which are taken up by the PET CT scanning machine, and we get a complete picture from head to toe, which helps in staging of the prostate cancer. So, means as compared to the conventional imaging, that is CT and MRI, PSMA PET CT definitely is more sensitive and specific over this conventional modalities, because it detects the disease in its early stage, which is generally missed by the conventional imaging, that is CT scans or bone scans. So basically it helps in proper staging of the prostate cancer patients.
Thank you, doctor. And this PSMA PET CT is the very informative things for all the viewers. So just would like to know about what is PSMA therapy.
So PSMA therapy. So PSMA therapy, that is, it is a form of radionuclide therapy, which is mostly used for metastatic castrate-resistant prostate cancer patients. So what is metastatic castrate-resistant prostate cancer? So it is a type of cancer stage or a stage of prostate cancer in which the cancer cells become resistant to the chemotherapy or hormonal therapy. And for such type of patient, this PSMA therapy, that is lutetium PSMA therapy, is very helpful.
And how it is, what we can say, the PSMA therapy benefits and how exactly this test get done?
So basically PSMA therapy, as we use gallium-68 for scanning purposes, we use lutetium-177, which is a beta emitter. So what is beta emitter? Beta radiation is a type of radiation which, when given, due to its high energy, that is of around 0.5 mega electron volt, it goes into the cancer cells and it disturbs the DNA of the cancer cell. So due to the damage of DNA, the cancer cells can't proliferate, and thus it helps in controlling the symptoms or the cancer.
And if we do the comparison between the MRI and the PSMA, what will you choose, the PSMA or the MRI?
So PSMA, PET CT and MRI both have their role in the staging of prostate cancer. So MRI is generally used for P-staging of the prostate cancer patients, and the PSMA PET CT is generally used to rule out distant metastasis or nodal disease, and which is more sensitive. The sensitivity and specificity of PSMA PET CT is usually greater than 90%. So both have their role, and means no one can replace each other. Basically, both the modalities complement each other.
Thank you, doctor. So can you help us understand what is the cost involved in the PSMA PET CT and the PSMA therapy?
So basically PSMA PET CT, the cost for PSMA PET CT scan usually is anything between 20 to 30,000 depending on the CT, due to the availability, depending upon the availability of the radio tracer. And this PSMA therapy, it is generally given for 4 cycles at the interval of 2 months, and it is generally given IV, and it's usually a daycare procedure, and as compared to other forms of treatment like chemotherapy, it is well tolerated. So there are as such no adverse effect of this therapy, and it is a well tolerated therapy. And the cost of PSMA therapy usually is anything between 1 lakh to 1.5 lakh. And it is generally covered by most of the, what we say, insurance companies.
Thank you so much, Dr. Rohit, and great, and thank you so much for your valuable time and this what we gathered great information. And thank you so much all the viewers for watching the live session. Stay tuned for some more videos, and please subscribe our this channel. And if you have any queries, you can put it in a comment or the messenger and post them in the comment section also. Thank you so much all the viewers. Once again, thank you so much, Dr.
Thank you.